Services Manager with the Kentucky League of Cities, and I'm joined today by Courtney, who is our Personnel Services Attorney, and together we are your Personnel Services team. First, I want to say we are honored to be able to assist you in any way we can, so don't ever feel like you're asking too many questions. I keep hearing from city officials that you're sorry to bother us again, but we know you have a job to do, and it's our job to make sure that you do it right. So don't hesitate to contact us. I'm very lucky that I'm able to do my job safely from my home, but I know that many of you on the front lines don't always have that luxury. And know that we admire your commitment and sacrifices, not only today, but every day. So with that, I want to go ahead and get started with the webinar. Maybe. All right, there we go. So today's webinar format will begin with Courtney and myself giving an overview of the federal law. We have materials to send to you, including this PowerPoint presentation, but because the DOL released the new regulations late yesterday afternoon, and I mean very late yesterday afternoon, we have been updating all of this material so that you have the most current information. Some other housekeeping items that I want to make sure that we mention is that if you have a question, make sure and use the Q&A feature, because that's what Courtney and I will be looking at once we start taking questions. The plan is to go through our materials first and then start taking questions. If you're having any technical difficulties, you can't hear us, you can't see the presentation, use the chat feature, and we have someone who is watching that chat feature and will help you with any technical difficulties that you have. So again, if you have any questions, make sure and use that Q&A feature so that we will actually see your questions. And if we don't have time to get through all your questions, just know that we will be responding to all of them even after the webinar. One other thing I want to mention is that we do not give legal advice. Legal advice needs to come from your city attorney. This is the best, most current information that we have put together. But again, if there's specific things that you need addressed, make sure that you're talking to your city attorney for that specific legal advice. Today's webinar is going to include a brief overview of recent federal law. That includes the Emergency Paid Sick Leave Act, the Emergency Family Medical Leave Expansion Act, talk about some information that came out in the past couple of days about emergency responders and how those are defined, and who and what you can do with those emergency responders, how you can handle them during the situation. We also have information that came out yesterday on
Okay, so it looks like maybe we lost Andrea. So give me just 1 second. I may try to pick up where she left off. Give me just 1 second.
kicked off, but I'm going to go ahead and start back with the Emergency Paid Sick Leave Act. So if you're hearing this again, well, you're getting a second repeated. So under the Emergency Paid Sick Leave Act, all public employers are required to provide up to 2 weeks of sick leave, or provide 2 weeks of sick leave up to 80 hours to an employee. And there are 6 reasons when this paid sick leave will apply. And the first one is subject to a federal, state, or local quarantine or isolation order related to COVID-19. The second is advised by a healthcare provider to self-quarantine due to COVID-19 concerns, or the employee is experiencing COVID-19 symptoms and they are seeking medical diagnosis. And that's one thing that the DOL really stressed in their regulations yesterday, is that they have to be seeking a medical diagnosis. So for these first 3 provisions, the number of hours that they're entitled to be paid for, if they're a full-time employee, is up to 80 hours in a 2-week period. If they're part-time, it's going to be based on the number of hours typically scheduled. So the DOL has said that you can do a look-back provision of maybe 6 months. So you look back 6 months and determine how many hours an employee averaged as a part-time employee or someone who has a varying schedule. How many hours do they average over an 80-hour period, or this 2-week period? How much do you pay? If it is specifically related to the employee in these first 3 provisions, you're going to pay them their regular rate of pay subject to the caps. And the first cap is $511 a day, or $5,110 total per employee. And that's for these first 3 items. The next 3 are caring for an individual who is subject to a federal, state, or local quarantine or isolation order, or advised by a healthcare provider to self-quarantine due to COVID-19 concerns. And remember here, and DOL was kind of clarified a lot of this last night as well, that caring for another who is subject to an isolation order or advised to self-quarantine, as described above, is not limited to only family members. And they specifically went into what was expected. So it may not necessarily mean that if my neighbor needs help, that I can take off to take care of them. It has to be someone that you have a relationship with. So it could be a family member, could also be a roommate or someone that you cohabitate with. And there's some expectation that you will be there to care for that person. The 5th one is caring for the employee's child, and it's the same definition as the Emergency Family Medical Leave Act. And that is a child who is under the age of 18, or a child who is over the age of 18, an adult person over the age of 18, who has a physical or mental disability where they are incapable of caring for themselves. So those 2, that was actually added in the DOL regulations. And this would apply if the child's school or place of care is closed, or the care provider is unavailable due to COVID-19 precautions, or the 6th reason, experiencing any other substantial similar conditions specified by the Secretary of Health and Human Services in consultation with the Secretary of Treasury and the Secretary of Labor. And the number of hours for this, again, for full-time employees, they would be paid 80 hours in a 2-week period. They would receive 2/3 of their regular rate. So for 4, 5, and 6, these 3 provisions right here, they receive 2/3 of their regular rate, subject to the cap, and the cap for this is $200 per day, or $2,000 total per employee. And note that there's going to be some emergency paid sick leave and emergency FMLA overlap, and I'm sure Courtney's going to talk about that, and we have some examples that we'll be going over as well to kind of help you decide how to handle those situations. All right, and I'm going to turn it over to Courtney.
Okay, so hopefully everybody can hear me. If not, let Soraya know in the chat box. So the emergency FMLEA, which when I talk, I will probably say EFMLA, because adding that extra E in there is just throwing me off. But this amendment that came through, it amends the existing FMLA statute to add this additional eligibility requirement when if the employee meets these requirements. So I know a lot of you are cities that are less than 50, so typically FMLA does not apply to you. That does not change. So traditional regular FMLA does not get expanded to make you all have to provide other FMLA, but all public employers are required to provide this emergency FMLA leave, regardless of the number of employees that you have. It's if you have one or more employees. So this provision, this specific provision will apply to you. If you have over 50 employees, you are going to, this is going to be yet another reason that someone might take FMLA leave, and those employees that use FMLA leave during the year, those 12 weeks are all included. So I just wanted to kind of throw that out there first. But for emergency FMLA leave, it is, again, all public employers. For this requirement, employees have worked at least 30 days. So it's a little bit different prerequisite there. It provides job protective leave for an employee who, and the definition is there, it's those that are unable to work or telework, and they need to have the leave to be able to care for their child, which is either under the age of 18 or, again, an adult son or daughter who is incapable of safe care. If the child's school or place of care is closed due to the COVID-related reasons. The first 2 weeks of the emergency FMLA are unpaid. However, keep in mind that reason number 5 under emergency paid sick leave is going to most likely and is intended to kick in and cover those first 2 weeks of pay. And so after that 2 weeks, or starting in week 3, emergency FMLA is paid, and it's subject to specific caps. So if Andrea can advance the slide for me, we'll talk about what those caps look like. So again, after those first 2 weeks, employers then must pay 2/3 the regular rate for the number of hours normally scheduled. Employees and employer may agree to use existing paid time off to supplement. That has to be an agreement. Intermittent leave is allowed, again, if the employer and employee can agree. But keep in mind that the Department of Labor is encouraging flexibility during this time. We're all having to adjust and make changes. So if it is possible, the DOL does encourage that flexibility to allow someone to use it intermittently. Job restoration. This is an issue that is based on the number of employees again. So if you have 25 or more employees, it's the same restoration rights as a traditional FMLA, which requires you to return them to the same position. If you have 24 or less employees, you're generally excluded from the job restoration requirements if the position no longer exists following the leave and you have made reasonable attempts to return the employee to an equivalent position for up to a year following the leave. So just keep that on your radar. I'm sure we will get into the issues of that once we finally get to a place where this COVID-19 is over, but we want to make sure that you all are aware of that job restoration requirement. Next slide. Thank you. So emergency responders. So over the last week or so, DOL's been providing us guidance on how to define emergency responders, because it was mentioned in the statute that agencies could exclude emergency responders from these provisions, but we finally got the definition, and it is very broad. So as of March 29th, the guidance states that, and I'm not going to read this verbatim, but this is the language that kind of summarizes it. It really is going to cover law enforcement officers, firefighters, emergency services, emergency medical technicians, paramedics, emergency management personnel, 911 operators. It's going to include your public works personnel and persons with skills or training in operating specialized equipment or other skills needed to provide aid in a declared emergency. And as well as those individuals that work for the facilities that are necessary to maintain those operations. So it's a very broad definition that they provided through the guidance and regulations. That means that you have the option of excluding those positions that meet this definition from receiving both the emergency paid sick leave and the emergency FMLA. However, DOL encourages employers to be judicious when using the exemption or the exclusion. And really what we are saying is, if you're going to exclude emergency responders, still allow them to take the emergency paid sick leave if they are either suffering symptoms or have been exposed, because otherwise, if you're not allowing them to stay home, you know, you're running risk of spreading the virus to others. So really, the exclusion, our recommendation is if you're going to exclude it for mostly that child care reason. Next slide. Okay, so we started getting lots of questions related to the travel ban. As you all are probably aware, our governor a couple of days ago, I guess it was, the days are blurring together for me, I don't know about you, I think it was a Monday on the 30th that the governor issued a travel ban that limited residents from traveling outside of Kentucky except for a short list of reasons. That triggers some things under these provisions, under the emergency paid sick leave, excuse me. It triggers that number one reason, because if they are ordered to quarantine because of the governor's order, or because based on this guidance, a local health department orders the person who has traveled out of state to quarantine, then that's an order to quarantine, and then they are eligible for those 80 hours. We recommend that you can't really exclude general employees from that, and there's no mechanism under the federal law to exclude them, but you can under the federal law exclude them. So we have provided some sample language in the order, which you are either have gotten or will be getting an email. Part of that language is on the slide. It just clarifies that if someone who is an emergency responder, if they violate the state travel ban, if they go out of the state for some reason that is not allowed under the governor's order, that you're not going to allow them to use the emergency paid sick leave. So that's our recommendation there. So the documentation for either the emergency FMLA or the emergency sick leave, those have come out, and those were a little more clearly defined in the rule that came out late yesterday. So this is the list of the items that you need to document. Again, on our handout that you will get an email for, one of the handouts goes through these two laws and has all of this available, so you will have it available as well as this slide. Just keep in mind that for the emergency paid sick leave, for those reasons where, you know, if they're under a quarantine order, they need to have the governmental entity, the name of the governmental entity that issued that order. And so based on the reason why, then that's the documentation that you're going to need to provide. One of the things I want to note on the child care related, either sick leave or EFMLA, there's going to need to be a representation that no other suitable person will be available to care for the child. And again, I think you have to make sure that you're managing and providing services to your citizens. So, you know, we want to make sure that we have employees that are making sure they're meeting the needs of the city. But this is one of those areas where I would also encourage flexibility with when possible. And just keep that in mind. Also, make sure you keep denial of leave documentation. So if you're going to deny leave, have documentation of their request for that leave, and then also making sure that you document why you're denying it, why it's insufficient, and keep that available. All right, so we're going to start with our first example. Employee who typically works 40 hours makes $500 per week. So that's kind of where we're starting. That employee's childcare is closed and they do not have a job that is conducive to telework. They would be entitled to 12 weeks of emergency FMLA leave, and the first 2 weeks, or those 80 hours, would be paid under the Emergency Paid Sick Leave Act as 2/3 of the required compensation, capped at $200 per day. And so since 2/3 of the $500 salary is $333, they're actually only receiving $200 per day. The next 10 weeks of leave would be paid under the provisions of the emergency FMLA at 2/3. Again, it'd be subject to that $200 per day. The employee can also supplement their pay using their PTO to get them up to $500 per day. And we are doing an overview. I don't want to get too far into the weeds here, but just to note that the way the regulation is written, you're not doing 2/3 of their hours. You're doing a calculation of what they normally work. So say it's 8 hours a day times 2/3 of their rate. So you'll want to figure out what is their 2/3 rate of pay, come up with a number for that, and multiply that by the number of hours that they typically work. Because again, they have 12 weeks of protected leave. So you want to make sure that you're reflecting the correct number of hours and then calculating the 2/3 on that pay. So hopefully that was clear. And next slide. An employee typically works a 40-hour work week at $500 a week. Again, same pay. The employee's childcare is closed and they do not have a job that's conducive to telework, but the employee's spouse is able to stay home with the child on Tuesdays and Thursdays. So that employee would be entitled to 12 weeks of intermittent leave if both the employee and the employer are agreeable. So if you're able to, again, flexibility. So for the first 2 weeks, they would be being paid under the Emergency Paid Sick Leave Act at that $200 cap. And so because their spouse is available on Tuesdays and Thursdays, they would be taking care of the child Monday, Wednesday, and Friday. So for Monday, Wednesday, and Friday, they're going to get that. I'm sorry, let me make sure. Yes. So for Monday, Wednesday, and Friday, they are getting $200 per day, and they're using the leave those days. And then on Tuesdays and Thursdays, when they're working, they're making the regular rate of pay. All right, and I'm going to switch it back over to Andrea.
Okay, hopefully everyone can hear me. On this example, we have an employee that, again, typically works a 40-hour work week at $500 per week. The employee has been told by a healthcare provider to quarantine for 14 days. The employee would not be entitled to EFMLEA because that is only applicable for if your childcare is closed or your childcare provider is unavailable. So in this case, the employee would be entitled to up to 80 hours in the 2-week period, and that would be paid to the employee under the Emergency Paid Sick Leave Act at the employee's required compensation. So whatever their regular rate of pay is, capped at $511 per day and $5,110 total. So since the cap is $511 per day and they typically make $500 per week, the employee would receive their full salary for that 80 hours that they're quarantined. Any additional time off that they may need would require that employee to use their earned PTO according to your policies, your personnel policies, or an employer can decide to pay the employee their full wages, as many employers are doing. If that is something that you can do, we highly recommend it. We know that can be costly, but it definitely helps your employees and definitely helps the morale of your employees, because many of them are out there working while they're watching their neighbors ride bikes and walk dogs, as I'm doing right now, looking out my window. So it's tough to be the ones who are out there on the front lines working. If you do decide to do that, so you do decide to go ahead and pay an employee whether they're working or not, especially if they're dealing with COVID-19 symptoms or the illness itself, you need to have a policy in place and make sure that you treat all similarly situated employees the same. Okay, the last example we have is that this is an employee who typically works a 40-hour work week at $500 per week. This employee is taking care of their roommate and has been told by a healthcare provider who has been told by their healthcare provider to quarantine for 14 days. So their roommate is someone that lives with them. Likely you would not want them to come into work anyway because they have been exposed to someone who may or may not have COVID-19. So this employee is not entitled to the Family Medical Leave Expansion Act because this is not child care related. This is to care for an individual. So they would get up to 80 hours in that 2-week period, paid to them under the Emergency Paid Sick Leave Act at 2/3 the employee's required compensation. And again, it's going to be capped at $200 per day and $2,000 total per employee. Since 2/3 of the employee's salary, $500 salary, is $333, they will only receive that $200 cap per day. They can use, if you're agreeable to it, earn paid time off, so vacation or sick time, they could use that to make up the difference between that, for that 1/3, or again, the employer could choose to pay them that additional 1/3 pay to keep them whole. All right, next we're going to look at the posting requirements. And that previous slide was the actual poster that is on the Department of Labor website. And by law, all covered employers, so that means all cities, are required to post a poster in a conspicuous place on their premises. So anywhere that your employees go, if all the employees come into City Hall, say to clock in a time clock, then you can post the poster there. But if there are various places that your employees are going, say your Public Works, only go to the Public Works building, you're going to want to also post this poster there. The regulations also say that an employer can satisfy this posting requirement by emailing or direct mailing this notice to their employees, or posting this notice on an employee information internal or external website. So especially if you have employees teleworking, you want to make sure that you are either posting it on an internal website that you have that employees go to frequently, or probably better would be to go ahead and email that notice to them so that they are aware of what they are entitled to. Employers have to provide this posting to all new hires and current employees, and they post it regardless of whether their state requires greater protections or whether you provide greater protections. You still have to provide this notice. So if you choose to pay 100% of an employee's salary, even when they're only entitled to 2/3 of the salary, you still need to provide them this poster. And again, post it in each building where the employees report for work. Employers do not have to provide the poster in additional languages, although I do know that they have come out with a Spanish version of this, but that is not required to post. And share the poster. You're not required to share the poster with recently laid off employees or applicants. All right, current employer action. Right now, the things that you need to be doing are, again, post that required notice and distribute the notice and make sure it's accessible to all of your employees, especially those who are working from home. Consider creating policies and documents for implementing the FFCRA, and we have examples of those documents that you will be getting, and those are the most current versions. So there's no requirement to have a policy in place regarding what's required unless you're going to do something different. You're going to provide more than what the law is requiring. I think at that point you should have a policy in place, but I think it's still a good idea because it outlines what is required. So it lets management know what they have to provide, and it lets your employees know what they're entitled to get. Also, be flexible. If there's any way, and I know it's really hard for most city positions, but if there's any way, teleworking. You know, the governor keeps saying, if there's any way to telework, that's what we should be doing. And consider working unconventional times. So if I have an employee who has childcare issues, I'm going to let that employee maybe work in the evening or during nap time or something like that, so that they're still able to care for their child that they have to keep at home. I'd rather have you working some than not at all. So, you know, keep that in mind, especially when we start doing the online school. Our grandson lives with us and he's going to be starting that next week. So people are going to have to be available to help him with these online schooling. So remember that and keep that in mind. And also, I know I said this in the first webinar, but remember too that we all need to be getting out, taking breaks, getting fresh air, keeping our social distance, helping those that, you know, that can't really help themselves, like older parents or grandparents. And be aware of that and allow employees the time to be able to handle those things. Also, make sure you're training your HR and payroll employees on these provisions, eligibility requirements, and the compensation requirements. I think also any supervisors need to be aware of what the requirements are and what they need to look for and when they need to notify HR or payroll or the city clerk as to when these provisions might come into play. Again, if you have if you're going to allow teleworking, be sure that your employees are paid for all hours worked. So make sure that they're documenting all hours worked, especially your non-exempt employees. So if I have an employee who's working 8 to 12 and then they have to take care of a child from 12 to 3, you know, or something like that, we want to make sure that they're being paid 8 to 12. And then if they start work again in the evening, that those numbers are being kept so that we are paying all of our employees for all hours worked. We also have a sample temporary teleworking policy. So if that's something that you're interested in, I created it specifically for COVID-19. So it addresses kind of the issues that we're dealing with now. So if that's something that you want to look at and tailor it to fit your city, we are more than happy to send that to you as well. Again, make sure your supervisors understand that they cannot retaliate or discriminate against any employees who need to take leave. I think especially for someone who may need to take leave for childcare, make sure your supervisors understand they are entitled under the law to have that time. There should be no discrimination. There should be no retaliation for doing so. Inform your employees of the leave notice and documentation requirements now, today. If you haven't already done it, make sure you put something together. If nothing else, send out that poster. Send out that notice that DOL has provided to every one of your employees. I think I would want to know that each person physically has received it, whether that's by email or putting it in their mailbox or whatever it may be. Just make sure you do that. And maybe email is better because we don't want to be handing things that have been touched by multiple people right now. Monitor federal, state, and local action on leave laws related to COVID-19. This is extremely important because I can tell you, I feel like every time I have this down, something new comes out and we have to change everything again. I know that in our office, they're probably tired of me saying, you need to replace this article now, you need to replace this order now, because the changes are happening so quickly and we expect to see more changes and more laws, more regulations related to this. So keep an eye on those. Keep an eye on our KLC COVID-19 resources page. We update those things daily. So if you want the most current information, go there. Even if you've received it, like you'll receive it from us today, it could change next week. And if it does, we will make sure that the most current information is on our website. So keep checking back to that website. Also, record keeping requirements. The Department of Labor and their regulations yesterday said under the record keeping requirements, you have to keep anything related to a request for leave for up to 4 years. So all the documents related to a request for leave have to be kept for 4 years, whether you approve it or deny it. So make sure that you are keeping those documents for 4 years on these employees. All right, and I'm going to turn it back over to Courtney.
Okay, so in the interest of time, I'm not going to delve into these other challenges in very much detail here. We have a couple of things on our website as well as in the email that you all are getting with the resources that cover these. But I just kind of want to flag them for you, make you aware. Reemployment of retirees. So we heard pretty early on from some cities that in order to adjust and fill in for first responders that end up getting quarantined, they wanted to be able to either use volunteer retirees or find a way to pay some retirees to come back. The governor issued an order that allows first responders. They've waived the typical requirements for reemploying a retiree if you fall into one of the law enforcement first responder categories. Those do not apply to other essential employees, so it does not apply to public works or our utility workers. You are still going to have to follow the reemployment requirements of the Kentucky retirement system. However, the KRS has provided us with some resources to be able to expedite that request. So all of that is in that handout. It spells out what you have to do if you're employing or getting a volunteer retiree for first responders, as well as what to do for other essential employees. So again, that is outlined in that handout. There's a lot of questions. It sounds like some guidance came out from health insurance companies over the last day or so saying, yes, you can keep employees that are laid off on health insurance. It is possible with some conditions, but there's also it's a more complex issue beyond just saying, yes, we want to keep them on the insurance. You want to make sure that the insurance premium payments are not considered wages under the unemployment definition, which is on the slide there. The main thing I want to make sure is that those that have plans where an employee can elect to receive part of the payment in cash instead of having it paid into the plan, that could complicate that piece. So you just want to be aware of that. I think that's going to be one of the main issues when it comes to wages for cities. But you also want to look at, is it going to change anything regarding eligibility on your personnel policy? And you want to be able to articulate, I think you will be able to, but be able to articulate public purpose. Keep in mind, if you're going to do some optional things like administrative leave that go above and beyond the federal law, you want to make sure you put that in writing. And lastly, there are lots of considerations and things to think about layoffs and unemployment, which I'm sure we're going to get to in the questions. All of course, reemployment of retirees is handled in one article that you will get. The others are covered in the staffing decisions handout that you all will receive. So if you want to get into the details of all of that, those will be available there. So I think at that point, Andrea, I think we're ready for questions.
All right, see if I can get this off this page and closed out. And if you want to go ahead and be looking at the questions, do you have them pulled up?
I do.
Go ahead while I'm trying to figure this thing out, because
okay. Well, I did.
Technically,
we're learning. One question that I saw, there's a question of whether or not we need to separate wages paid under the federal law versus wages that are paid that exceed that. So if you're going to supplement and pay them above and beyond, yes, you want to account for those separately. You want to make it clear what wages are paid under the federal law, and then pay it separately if you're supplementing with that. So,
okay. All right, it looks like we have a question here that says, are we going to pay $500 a day when they only get $500 a week? And the answer to that is no. You're going to pay them up to $500 a day. So if that's if they make less than $500 a day, that's the max they will get. They will not get any money in addition to what they would normally be paid. They just can't be paid more than $511 a day.
The next question is, if an employee is at higher risk for getting the virus and is asking to self-quarantine for fear, and also because the state and local officials are telling people to self-quarantine, would they qualify for a reason to be paid? That is a complicated issue. I started reading it and then I wasn't prepared for the answer. We're gonna, like we said, we're learning this as we go, and I'm one of those that I gotta process it for a second, so I apologize. Yes, I do think that given the state of where we are, I think it's probably reasonable, as long as there's a discussion of what causes their higher risk and that it does actually fall into a category that the CDC has acknowledged is a higher risk. So the things that come to mind for me in particular are based on age, any kind of lung condition, asthma, those sorts of things. Those are definitely putting people at higher risk. So it's possible that that would be reasonable for them to isolate based on the guidance that we're getting both from the CDC as well as local health departments. Andrea, do you have anything to add to that one?
No, I think that covers it.
Okay.
All right, looks like the next question we have is, we currently have an employee that was advised to self-quarantine and we have abided and sent her home. So when we pay her, do we only pay 2/3, or can we pay her full pay as long as we do that for anyone else that falls in the same category? So this is an employee who has been advised to self-quarantine. So they are going to qualify for 100% of their pay up to the $511 cap. So for them, this isn't going to be an issue unless they make more than $511 a day, and then you could choose to supplement as well, as long as, again, you are providing that to anyone in that same situation.
So the next question I have is, do we have to have a how we will pay policy in place if we agree to go with the requirements set forth? Technically, if you're just abiding by the federal law, you don't have to have an order or a policy in place, but we do recommend that you adopt it to make it clear that you're providing leave according to the federal law. And since there are some elections for you to make, whether or not you're excluding first responders or not, it would be good to have that in writing. Again, at the end of the day, the federal law controls, and you're going to have to abide by at least providing that. So it really wouldn't require you to do it, but it is best practice to adopt it. Most cities, I think at this point, have enacted a local state of emergency under KRS 39B. If you do that, our sample orders that you'll receive could be adopted by executive order because you've declared that local state of emergency. So just keep that in mind.
All right, it looks like the next question we have is, regular rate means the hourly rate without the incentive figured in, correct? And then in parentheses, we figure in incentives for overtime figures. I would include your incentive rates as well. I have nothing to really base that on right now, but I think definitely I would include any incentive pay in your regular rate. Make sure the employee is getting what they would typically be paid for that day. Do you agree, Courtney?
I do. The next question I have is, how would you advise calculating pay for an employee who works a partial day from home but is not able to work a full day because of childcare duties? So I think, again, that goes back to record keeping. And if you agree to allow intermittent leave, you could do that. So have them document, say they have childcare, a spouse is at home, so they can work in the morning. So they work from 8 to noon. They're working that. So you document, this is worked time. And that's 4 hours. So then say they need 4 hours of leave time to be able to cover the rest of the day. Then you document 4 hours are the EFMLA, and then calculate their 2/3 rate and multiply it by that 4 hours. And so then that gives you what they're entitled to for the day. And then if you decide to supplement, you would do that on top of that, but that would be how you calculate those hours.
And Courtney, one thing I remember us talking about earlier was supplementing for overtime.
Mhm.
And I can't remember exactly what it was we were talking about, so maybe
Yeah.
maybe you do.
So we were kind of hoping not to get this far into the weeds because this gets really complicated, but I do think it's worth flagging for you guys. For those that are supplementing, because you're going to want to review what your overtime policy is. Many of you I know have overtime policies that say you include not just actual hours worked into overtime, but you also include maybe sick time, vacation time, other sorts of leave into overtime calculations. If you do include leave time in your calculations for overtime, you're gonna potentially run into an overtime issue when you're supplementing pay. And the reason for that is let's say it's a straight 8-hour day and the entire day is EFMLA leave because of childcare issues, and you do the calculation, it's 8 hours times 2/3 of their hourly rate, right? So you're including, it's 8 hours under that leave time, but technically to be able to supplement, you then have to add some additional PTO time to get them to their full, what they would make for a typical 8-hour day, okay? That means that they may be on paper, they may be actually working or taking leave time of 10 to 12 hours in the day, 8 hours of it being the federal leave, and then the rest of it being something from some sort of paid time off time. If you provide overtime on leave, if you're including the leave time into your overtime calculations, you're going to end up paying out more than 40 hours of leave. And so then you're going to kick into overtime. You could potentially look at amending your overtime policy and clarifying that you're not including this federal law into your overtime calculations, and that would fix that. But if you don't fix that, you're going to potentially run into the overtime. Hopefully that was helpful. I'm still getting used to making sure that it's hard to interact. So
just call us.
Right, yeah. Always just call us if you have more questions. Next question that I see is, if your employee has been advised to self-quarantine by a doctor and has already been off for 2 weeks and feels like she should not have to use her paid time off, what are our obligations to her, even if she does not return to work for an extended amount of time? So that's a complicated issue. The 80 hours is affected. So the emergency paid sick leave, which is what would apply in this situation, because again, it's one of those first 3 categories, and it's that she's been advised to self-quarantine. I think that off the top of my head, that's reason number 2. So beginning April 1st, she's entitled to 80 hours. Even if you elected to provide something before that, this law is not retroactive, and it is clear that they give an additional 80 hours. So from April 1st, for the next 2 weeks, she should be using the federal leave. Now, if she took time off before this, she would be using her own leave time to be able to be paid, or she could elect to be unpaid, okay? And also just keep in mind that if she's being quarantined, unless she gets significantly ill, she probably will be able to come back to work after that 2 weeks. That's why it's designed that way. So anything else to add to that one, Andrea?
Well, and if they were to become significantly ill, then at that point FMLA may kick in. So they might have leave obligations under that. And as far as the paid time off, if that's going to depend completely on what your policy says. If it requires an employee to use that paid time off whenever they are sick, then they have no choice. They have to use that paid time off. So it depends on how exactly your policy is written for that. All right, the next question I see on here is, what about city council meeting? I'm not really sure what that question is in relation to what we're talking about. So if you want to give us more information, or if you want to call or email us later, we'll be happy to answer whatever questions you have. So the next one is, if the employee is seeking diagnosis, if experiencing symptoms, they will be paid at the regular rate. And that's correct, for that first 80 hours. And if they are just experiencing substantially similar conditions, they would be paid at 2/3 the regular rate. And that's not correct. So here's how you need to think about it. If it is related to the employee's sick, the employee is quarantined, if it's specific to the employee, then they will get their full rate of pay. If it is something outside of the employee, if it's childcare related, if they're caring for another individual, that is going to be at the 2/3 rate. So just remember that if it's related to the employee being ill or having symptoms or being isolated or quarantined, they will get their full rate of pay. And if it is not related specifically to that employee, but another individual or related to childcare, that's when the 2/3 kicks in. And I know this is really confusing and really complicated, and that's why I keep telling people, as specific scenarios come up, call or email Courtney or myself, and we are happy to try and help you walk through them.
Just one thing on that, I think the language of that substantially similar is in number 6. And so it is if the employee is experiencing substantially similar, but part of the issue too is that really in the state of Kentucky at this point, if you're experiencing symptoms, there are orders to say that you need a quarantine. So that's really why it's really going to fall into the full pay. There is my reading of it as well. So next question I have is, I think we answered that one. The next question is the intermittent leave handled like traditional FMLA, where it results in 480 hours that could be used for childcare until 12/31/20, as long as schools and daycares are closed? And yes, that would be, they get it. So, and I know this, I know the person who answered this question, I know you have more than 50 employees, so you would have people that are eligible for FMLA more generally as well. You get that 12-week, for a full-time employee, that 12 weeks of full-time pay, and you would be using that intermittently through December 31st. They'd have that available. So yeah, I think that's it. I don't, I think that was simple. I was feeling like there was more to that answer, and I don't think there was.
All right, so the next question is, if an employee has been in contact with someone who is experiencing symptoms of COVID-19 and is being tested, does the employee need to quarantine at home until the test results of the other individual are received? Should some kind of documentation be required for this? In this in this case, the employee, if they've been in contact with someone who's being tested, likely they're going to be told by a doctor to isolate, to quarantine at home. And so you're still going to have some type of medical information that tells you that this person has to quarantine. Because if they've been in contact, they're probably going to contact their doctor and ask them what they need to do at this point. So if what they have to do is quarantine pursuant to their doctor, you'll have that documentation. And then, of course, if the test comes back positive, the employee needs to quarantine for 14 days. And yes, that is correct. And so if it ends up going over that 80 hours during the 2-week period, then that employee is going to have to use their paid time off, their accrued paid time off, pursuant to your policy. And one other thing I want to say about the 80 hours, I know we have a lot of firefighters. So if we have a firefighter off and say their schedule is 24/48, we are only required to pay them 80 hours in that 2-week period. So it's possible that they may work over 80 hours in that 2-week period. And if that's the case, they are only paid for up to 80 hours. If you choose to pay them more, that's fine, as long as we're treating everyone the same. All right.
There is a question about whether or not recreation maintenance is included as public works. It depends. That's my famous attorney answer. It depends. Do they meet? I think what's contemplated by the definition is more are they essential to maintaining the facilities? Are they essential to maintaining services to cities? I think that's what they're getting at with public works. It's possible that those in maintenance are going to fit that definition. I would want to look at what they're doing, what services they're providing to the city. Is it essential? Are they maintaining facilities that are necessary for the other life-sustaining operations of the city? So possibly, but it will depend on what they're actually doing.
All right. Our next question is how to handle secondary employment. How does the 80 hours work with one employer placing an employee on leave for COVID for potential contact with that employer? How about the secondary employer? Will there be a report needed for both employers to be notified? How can you track the time? Is the 80 hours only a one-time use? Hope I haven't confused you. At this point, I stay confused. But how to handle this. So if you have an employee working 2 jobs, the 80 hours is per employer. So if I work 2 jobs, if I'm working at KLC and I'm also working somewhere else, I can't even think of any place that would be open right now. But if I was, say for example, I can't think of anything, never mind. So I would be paid, I'd be entitled to 80 hours in that 2-week period from KLC. And then for my secondary employer, I would be entitled to up to 80 hours that I would have worked for that secondary employer. So if I only work 20 hours a week for that secondary employer, then I'd be entitled to up to 40 hours of pay from the secondary. So yes, I could get it from both employers if I'm working 2 jobs. And yes, both employers need to be notified. I wouldn't even worry about the secondary employer. You just worry about your employees, providing them their 80 hours through what you have to provide, getting the documentation that you need to make sure that you have that on hand in case you are audited in the future on this, or in case there is a lawsuit filed against this. Just make sure you have all of that information. So hopefully that answers your question, and if not, feel free to reach out to us.
So the next question is more of a poll question for you guys of whether or not you are likely to exclude first responders. So I'm going to leave that one up there and let you all, they've asked if you are considering likely to exclude those first responders, to mark it with a thumbs up, to upvote it. So I'm going to leave that one up there so that you all can do that. And so then I'm going to move to the next question. Is the employer required to pay the additional 10 weeks too? And yes, if they qualify for the emergency FMLA based on the child care provision, so their child's care center is closed or their school is closed related to COVID-19, you are required to pay that 10 weeks at that 2/3 rate.
All right, the next question. Are there any special documentation requirements for hours for salaried employees in situations where they are actually working part days, teleworking, or in the office? Not necessarily. I would say if they're being paid, if it's a childcare related, and gosh, that's probably one I'd want to think on a little bit, honestly. Yeah, let's not dismiss this question, because I think I'd like to look at this one a little bit more as far as how you would handle that if they were working partial days, because under the FLSA, there are specific requirements as to how to pay. So let me look at this and I'll get back to you.
So the next question is, what if you had an employee out due to displaying symptoms of COVID-19 prior to April 1st? Do they qualify for this, or do they have to use their own leave time? So again, any time prior to April 1st, so at March 31st or earlier, that time would need to be their own time. Or if you adopted some policy locally that you were going to pay that, you could be paying that and it not come out of their leave balance. But starting April 1st, a new balance of the 80 hours is available. And so anything April 1st or after, if they qualify, they're going to fall under the federal law.
All right, the next question is, we have altered, and the questions keep moving, we have altered our work schedule to where we are working 36 hours, 3 12-hour days a week instead of 40, 5 to 8 hour days. but still, and someone's knocking at my door. But we'll still pay employees 40 hours if someone takes 1 or 2 days off for childcare. Can we pay the 4 hours or fill it 2/3 pay? So let me read this again because I was distracted. We have altered our work schedule to where we are working 36 hours, okay, instead of 40. But we'll still pay employees 40 hours. If someone takes 1 or 2 days off for childcare, can we pay the 4 hours off, 4 hours at 2/3 pay?
So it's the 4 hours that they've reduced.
Right. Yeah, I think you could. As long as you're treating everyone the same who's in that same situation. Sounds like that might be an accounting nightmare, though. I think if I'm paying everybody for 40 hours, I would probably continue to pay for the 40 hours and just keep everybody whole. And I can tell you, by keeping everyone whole, if you can do it, that is really going to increase the morale of your employees. They are going to be so grateful to you for being understanding and working with them and keeping their benefits going, because if for some reason you had to lay them off, yes, they'll still continue to get income, but they could lose their insurance. That's another question that we've already talked about. But they're no longer going to be contributing to the retirement system, which is a big deal, especially if someone is close to retirement. So, think about those things. You have to weigh what's best for you and your employees. So before you make these decisions, weigh, is it going to be more costly for me to go route A or route B? So just kind of work those issues out.
And I just want to acknowledge for everybody, and I got some weird feedback, so hopefully that's not my audio messing up, but it is 3 o'clock. We were scheduled for an hour. We're going to continue to answer questions for a little bit because we're only about halfway through the questions, it looks like, and you may even still have more. So we are going to continue. The credit is just for the 1 hour. If you signed up and were interested in the credit, it will be for the 1 hour, but we are going to continue since we have so many questions. So the next question is that we closed a few days before the governor ordered facilities such as ours closed, which was also prior to April 1st. Would our non-essential full-time staff be entitled to paid sick leave? Also, our full-time staff works a 35-hour week. So if the city decided to close, that's not one of the reasons contemplated by either of the federal leaves. That was an election to close the facility, but it's not going to trigger emergency paid sick leave or EFMLA. So you could choose to offer something like the optional administrative leave and pay them for that time. So you can do that, elect to do that. We've got a sample of an order for that, but no.
All right, so the next question is, it is recommended by KLC that we pay our employees full pay if they're ill or quarantined. And let me just say, we do recommend that if it's possible for you to do that. If it's not possible for you to do that, I mean, we understand that it isn't always, the money isn't always there, but if you can, that's certainly the best way to handle it. Then the question goes on, it is also recommended that we pay them if they have childcare issues. And again, I would not treat anyone different. If they have to be off for something related to COVID-19, if you want to continue to pay them their full salary, I wouldn't differentiate between the issue. Whatever the issue is, I would pay them full salary.
One thing, sorry, just to clarify, I think at one point when I was talking, I did say, I was talking about for the emergency paid sick leave, where you can exclude the first responder or the emergency responders. Again, that is possible that a city may need to, because they have to have their first responders, maybe they can't afford to have the first responders taking off this paid time off for childcare issues. If you're going to exclude them, that would be that piece of it. So I think that may have been generated because of what I was saying. But again, at least allow your first responders or your emergency responders to be included in the sick leave pay for the sick reasons. So the next question is, we have an employee who is seasonal. He's not eligible for sick or vacation leave because of the seasonal position. He is sick, but not with COVID-19. Is he supposed to be paid for days off from being sick from something else? And that's no, this is limited to COVID-19 reasons. Now, if that seasonal employee had been employed for at least 30 days prior to needing the leave, then probably is entitled to COVID-19. Would you agree, Andrea?
Actually, for the paid sick leave, he would have only had to work 1 day.
Okay, yeah.
So if he had worked there 1 day, he would be entitled to. If this was COVID-19 related, he would be entitled to pay, and that pay would be determined on what his average weekly hours are.
The second part of the question is, at the same time, the office is working 1 person per day. Some of the office staff is working from home, some are working less hours than normal because they can't work from home the days that they're not in the office, and they get paid their normal hours. That's okay. Again, if you're deviating from your typical leave, again, we want to try to put that in writing. Use that administrative leave order that you all get as a starting place, but tailor it to what you all are doing. Just try to, as closely as you can, describe what you're doing in practice to make sure that they're paid, just to make it clear to employees this is because of COVID, this is not a change to your other leave policies, and just to make sure everybody's clear on what is available.
All right, and the next question is, can we get the DL poster to post on the DL website? Yes, it is available on their website. It is also available on our COVID-19 resources page. So if you go to klc.org and you go to the COVID-19 resources page, you will see under an employee information, there is an article there on the notice, and there's a link in that article. And I also see that someone posted the link to our resources page with that poster on here. So you have that, Mayor Wagner, that is available for you on here or on our website.
So the next question is whether or not payments made to city employees under either leave provision are subject to normal withholdings. Yes, because they are. What this is directing you as an employer to pay these wages. So they would be subject to normal withholdings. So yes.
All right, and the next question is super easy. I'm glad I got this one. Will we get the slides from today along with the handouts you mentioned via email? Yes, you will. You will be getting all of the materials, including the webinar slides in your materials. If for some reason you don't get them by tomorrow, let me know and we will make sure and get those to you.
This is the next question I see is something I want to address separately because it doesn't sound like this is COVID related. So we will answer that later. There's a question, it looks like maybe just to clarify, it's a one time of 80 hours. And yes, that's correct. It would just be one time of 80 hours. So once they have used that 80 hours, and this is probably going to happen where you have our employees that are dealing with the public, especially first responders, they're ordered to quarantine at one point and then they have to quarantine sometime later. They're going to have to use other leave provisions under your policy, whether it's paid time off, sick leave, whatever it may be, to be able to take that time off. So yes, just one time of 80 hours. You have anything? I don't know why I kept going. It's your turn.
My turn. I want to make sure I'm correct. If an employee is off for childcare reasons, it is 2/3 of their pay. Yes, under the law, you're required to pay them 2/3 their pay up to the cap of $200 a day. So though that's your cap, that is true. Again, you can allow them to use their paid time off to pay for that other 1/3 so that they're whole. So they can use their own leave time, their accrued leave time, to make themselves whole, or the city could choose to, again, pay them that additional 1/3 and make that employee whole.
The next one is the recreation facility closed on March 13th, and our part-time employees working up to that date qualify under each of these acts? And they will not. the DOL issued guidance, I think it was on March 24th, that clarified that the statute would not be retroactive. So it's only available to employees that qualify April 1st and moving forward.
Okay, and a couple of things. I just saw that Governor Beshear has recommended schools close through May 1st. So this is, definitely going to be affecting this emergency paid sick leave and the EFMLA. Also, I received a message that it likely will be tomorrow before you receive the materials. So I wanted to make sure that you knew that. If you don't get them today, don't worry. You should have them by tomorrow. If you don't get them by the end of the day tomorrow, let me know and I will make sure that you get them. All right, is it my turn?
I don't know, I've lost track.
And I don't even know where we are, so.
Well, I'll take it. So our facility is closed. Does that mean that everyone qualifies for emergency sick leave? And the answer is no. Do you agree? I mean, the facility closing is not necessarily due to an order. Now, if we get to a place where it's a clear order from some authority that everyone has to close, everyone has to stay home, I don't think that's going to happen where it impacts cities. But if that were to happen, then more clearly, yeah, they would be entitled to that. But at this point, the orders are not requiring you all to close. And so there's no order for that.
So the next question is, if I have part-time employees who are also eligible for overtime, which that's a little confusing to me, but I guess part-time could occasionally get overtime. How do I calculate the average hours of the last 6 months? And the Department of Labor has actually set this out in their regulations as to how you make those calculations. So I am going to write your name down and I'm going to get you exactly how they say to do that 6-month calculation. And if they haven't worked for you 6 months, what they say is you look at what you normally would have scheduled them for the 2-week period. So if they haven't worked for you 6 months, you look at what did we agree upon? And in most cases, when you hire someone, you give them a notice or a letter saying, these are your benefits. This is going to be your hourly rate, your salary that you're going to receive for doing this particular job. And so you would base it, mainly you would base it off of that information, whatever you would have agreed to when you first hired them. But I will get that information and send it specifically to you so you'll have that.
Okay, the next question, which I just lost my Q&A panel. Would electric linemen and water and wastewater treatment plant operators be exempt from EFMLA? These are critical to communities and only certified individuals can work these positions. I do think that they're going to fall under that emergency responders definition. Do you agree, Andrea?
Yes, absolutely.
So I do think that you can exempt them for that. So if that's necessary for you to do, you are able to do that under the federal law.
All right, and there's no requirement that you exempt them, that you are, you just have that option. And a lot of smaller departments, they may not have a choice but to exempt them because they, if it's a child care related issue, we need you to come in. We need you to try to make arrangements. And I know the state has worked really hard to make sure that there are places available to assist our first responders in getting child care. So again, you have to determine if that's something that's absolutely necessary in your organization. All right, the next question, if employee is out on emergency sick leave pay or emergency FMLA, wouldn't this be like being out on workers' comp for the purposes of CLEF? And the city should pay CLEF at full amount anyway. If so, why include in the 2/3 rate? It is not like being out on workers' comp. It's basically like being out on paid sick leave. So if I have something other than COVID-19, let's just say I have bronchitis and I have to take off a couple days to recover from bronchitis, I'm going to use my sick leave. So that would still be subject to left funding and all and incentive pays. So don't think of it as workers' comp. It is not like workers' comp. It's different. So it's still going to be subject to your retirement. They'll still get time for going towards retirement for this leave.
So the next question is, a first responder also has a spouse in the healthcare field. Are they eligible for emergency FMLA for childcare if the child has a comorbidity? do they need to prove they have no other childcare available? So I'll start with the second question. If they're asking for the leave for purposes of childcare issues, they do have to show that, or it's not really a documentation issue, but you do have to have a reason or a statement that, yes, there's no other childcare available. And I'm trying to think of the first part of it. I mean, if you're not excluding your first responders and they have childcare issues, then yes, they would be it would be an option for them. And I'm guessing if the spouse is in the healthcare field, they're going to be working outside of the house, so they probably are going to have childcare issues. So yes, I do think they would be eligible unless you make a decision that you're going to exclude your emergency responders and you're treating all of your emergency responders the same and excluding them.
All right, the next question. If an employee's spouse has to be quarantined from their work for 14 days due to traveling out of state, does the employee have to quarantine at home as well for the 14 days? And, you know, just off the top of my head, I would say no. As long as that employee didn't go out of state, they would not have to quarantine for 14 days. Courtney, do you agree with that?
I do, unless they were ordered. So more than likely what would happen from a practical standpoint is if the spouse was ordered to quarantine, if that spouse's either healthcare provider or health department, if they received an order to quarantine and that either official or the healthcare provider said you also need to make sure your spouse quarantine, then that would trigger it. But without a direction related to your employee, you don't just assume that just because the spouse is quarantined that they have to be as well. There has to be some sort of order from the local authorities, an order from the, or not an order, but a direction from the healthcare provider that yes, the spouse should isolate or quarantine. Oh, is that me? Sorry. If we think an employee may qualify for the leave, is our only requirement that we post the notice and make sure they have seen it? Is it up to the employee to actually reach out to apply? Correct me if I'm wrong. The reading of the rule is that it is the employee needs to notify that they're needing to use this. But I also think that, again, in light of how FMLA is traditionally treated and in light of some of these flexibility issues, I think the DOL is going to say, if you know, you need to go ahead and designate that. I think in most cases, you're going to know the reason that they're out and know that they're going to apply to that. So technically, the employee is going to need to give notice that they need to use this, but if you're aware, go ahead and designate it. Would you agree?
I agree. All right, so the next question, if an employee tells me he does not have the coronavirus, but he hasn't been to a doctor, should I provide the emergency paid sick leave? No, if they need to be off and they're saying it is not related to COVID-19, they would not get the emergency paid sick leave. They would have to use the paid sick leave provided through your policies.
The only thing I would add to that is that because COVID-19 is at pandemic levels, there's been a little bit of relaxation of some of the ADA things that you can ask under the ADA. So if he is saying, oh, I don't have coronavirus, but he's showing symptoms such as fever, chills, body aches, as well as a cough or sore throat or some other things that are indicating that he has the symptoms of COVID, then you might want to ask some additional questions related to that to determine whether or not there's some risk of exposure from him reporting to work.
All right, but they still wouldn't get their paid sick leave unless they provided you something from a healthcare provider or they had been told by a healthcare provider. And that's the other thing is when it comes to healthcare providers getting us a notification that someone needs to quarantine or they actually have COVID-19, we have to remember they are really busy right now. So we need to be flexible and understanding and know that this is going to come at a later date. And so if an employee calls me and says, I have COVID-19, the healthcare provider told me to stay home. Okay, fine, stay home. You pay them their 80 hours. If they don't come back with that, they can ever come back with that documentation, give them a reasonable amount of time to provide it. And if they don't, well, then that 80 hours would then come out of their sick leave bank if they don't provide you documentation. But again, be flexible and allow them time to get that information.
So the next question, I don't know who it is, but I'll take it. What if an employee has already used their 12 weeks of FMLA for birth of a child? Are they still eligible for the 2-week emergency paid sick leave for not having childcare? And the answer would be yes. So they wouldn't be eligible for EFMLA, but they would be eligible for the emergency paid sick leave.
All right, next question. What do we do if an employee is required to quarantine and we are paying them and they are not staying at home in quarantine? What options do we have? Well, if they've been directed to stay in quarantine by a healthcare provider, I think I would contact my health department. You may even have to get law enforcement involved to get them to stay home, because they should not be out spreading the virus to other people. Courtney, is there anything else that you can think of?
I mean, I think the way it's being handled in most counties for people who are ignoring quarantine orders, or that health departments are seeking court orders for those individuals to stay home. I know even in Louisville, the court orders come with an ankle monitoring bracelet. So I think that's the best next step for the employer to take, is contacting that the local health department. If an employee is working secondary employment that has a high risk of exposure, like in a grocery store, can the employer require the employee to stop working that job? Can the employer require that employee to self-isolate for 14 days due to the high likelihood that the employee has been exposed? So first question, we've actually been researching this today about the secondary employment issue. We do think that you can require that secondary employment cease during this pandemic. I'm going to write down your name and follow up and send you that case law that we pulled today. But so it's possible for you to keep them from working that other job. The second question is whether or not you can require them to self-isolate for 14 days. I think that one's more complicated. I don't know, unless you knew that they were working in close proximity to someone in that store that did test positive. Maybe, I don't know. What do you think, Andrea?
Yeah, I mean, I would be leery of having them self-isolate just based on the fact that they work in a grocery store. So I would be really leery of that, of doing that. But yeah, that's definitely one we can follow up on. And I know I just got a message from our office. And I guess we're probably getting to the point to where we have to wrap up. And what we have been told is that we will get a list of all of these questions. So we will make sure that if you did not get an answer, that we will make sure that you do get one. We'll probably work on that this afternoon and get all these responses back to you, and no later than tomorrow for sure. So I think of that, we probably should wrap it up. And so I really want to thank everyone for attending, for joining us. And I look forward to serving you in the future and answering your questions and being involved in several more webinars that we have planned for this month. So be looking for those. And remember to keep in touch with the COVID-19 resources page that we have at klc.org. We keep that updated, like I said, on a daily basis. And everyone stay well and stay safe, and we will see you again soon. Thank you.